Carmen Byker Shanks. I am an Associate Professor of Food and Nutrition and Sustainable Food Systems in the College of Education, Health, and Human Development at Montana State University. As a public health nutrition scientist, I work with people and communities to support healthy and sustainable eating patterns. Early in the COVID-19 pandemic, I learned that people in Montana, just as across the world, were struggling with food and nutrition security. That is, getting enough nutritious food to sustain a healthy and active life was becoming even more challenging. In the midst of a pandemic that has been characterized by decimated incomes, panic buying and food hoarding, disrupted supply chains, and a sharply reduced workforce, my colleagues Michelle Grokey, Justin Shanks, and I knew what we had to do. In the face of such tremendous societal transformation, there was knowledge to be gained. We had to collect data on the very important topics of health and well-being, which includes food and nutrition security, to give local Montanans a voice during these trying times. This survey was designed so that communities, organizations, and policymakers can understand the additional impact of COVID-19 beyond COVID-19 itself on people's lives and build back better as we move out of this pandemic. We asked quantitative and qualitative data about demographics, economic security, food and nutrition security, health conditions, health behaviors, and information and media use. We received 1,944 responses from every corner of Montana. I knew from my previous work that we have already been living in a food system emergency. Food insecurity hovered around 11% in Montana pre-pandemic. From the food and nutrition security questions on the survey, we found that COVID-19 only made it worse. Food insecurity substantially increased to 18%. Individuals with children in the household were more likely to experience food insecurity. Food insecure individuals experienced greater economic hardship and reported a higher level of underlying health conditions such as diabetes and obesity. Food availability declined. Dry ingredients, animal proteins, and dairy were the most frequently cited unavailable food groups. 77% of respondents indicated that some of the foods they needed were unavailable when they shopped. The crisis of food and nutrition insecurity has existed over time. We have a responsibility to solve an unexcusable problem in a society where enough food and resources really exist for everyone. We just do not distribute them equitably. Food should be an awesome experience for all of the time, even during a pandemic. Tasty, healthy, meeting cultural needs, and be about making good times. Our survey results provide a platform to listen to local Montanans' experience during a pandemic, which help us to see, hear, and understand the issues related to well-being, including food and nutrition security, more holistically, and build strategies in the future to change our world for the better moving forward. You can find more information about the survey results at the link listed on the screen or by emailing me at cbykershanks@montana.edu. I'm grateful to Montana State University's Center for American Indian and Rural Health Equity, also known as CARE, for supporting my work as a research project leader. I'm grateful to you for listening, and please be in touch.